We are back with a really important today's checklist as we start to spend more time outdoors. May is Skin Cancer Awareness Month, so this morning we want to walk you through literally what to look for and how to protect yourself. Dr. Angela Lamb is a board-certified dermatologist. Dr. Lamb, good to see you again.
Nice to see you.
So millions of folks are at risk for skin cancer, and it affects millions. What are some of the things we need to look at for this?
Really, the things you want to look at and be mindful of is that skin cancer is actually more common than we would think. It's actually the most common type of cancer we have. So imagine, look, we have about 9,500 people diagnosed daily. 1 in 5 Americans will get some form of skin cancer in their lifetime. And then melanoma, the most serious type, exactly, which we'll really dive into. Wow. Really 20 people die daily from melanoma.
Now, what are some of the risk factors?
The risk factors really are skin type is one of the biggest ones, and lifestyle. So for example, if you don't have a lot of melanin, blonde hair, blue eye, maybe red hair, spend a lot of time outside, really that's your most highest risk factor. And then also the amount of UV exposure. So if you were a lifeguard, if you're a pilot, anyone that has a lot of UV exposure and is not protected, because you can be outside, but you have to be protected. So if you're out and not protected, that's where we run into trouble.
So prevention is the key.
Really, it's the key. The prevention, and there are things we can do. But here's what you want to look for as far as your self-examination. So we know, or most people should know, about these A, B, C, Ds of melanoma in particular. So asymmetry, that means if you fold a lesion in half and the two sides don't match, that's when we get concerned. The border, if it's jagged, doesn't make a perfectly round circle. Color, several different colors inside, diameter. We usually say the rule of thumb is about the size of an eraser head, so 6 millimeters. And then if it's changing, so really, you know, these are melanoma, but I tell people for other types of skin cancer, anything that changes, any non-healing bleeding sore, anything that's giving you pain, that's when you want to reach out to your dermatologist.
Okay. All right, Dr. Lamb, so we've got melanoma pretty well covered there. There are other types of skin cancer. How can you tell the difference? How can you spell the difference?
Yeah, so I think this is so important. This is one of the most important things I hope folks take away at home is that there are other types of skin cancer beyond melanoma, and these are easily missed. So basal cell and squamous cell, those tend to look like basal cells. They look like kind of translucent pimples that don't heal when somebody washes their face. Squamous cells look like an itchy sore sometimes that comes on really quickly, like dome-shaped. And then, of course, melanoma, usually it's dark. But people miss basals and squames quite often because they just think every type of skin cancer is dark, and most of them actually are not.
And there's also, I think, a common misconception in certain circles that brown people, we aren't necessarily susceptible to skin cancer. That's not true.
No, so we are less susceptible, but we can still get it. When we have it diagnosed, it tends to be more advanced because it's in areas that people don't pay attention to. So it tends to be on the palms, soles, also in the nail bed. So still wear your sunscreen. That's so important.
Speaking to that point, how can we decrease our risk of skin cancer?
Really, so especially as I mentioned with Al, you know, folks that have your type of skin cancer are at higher risk than somebody with my type of skin, for example. But wear your sunscreen. Everyone should be wearing it. I think this idea that if you have darker skin, you don't need sunscreen, that is a huge misconception. So you want to look for the SPF on your sunscreen on the bottle, at least 30. So 30 is going to get you to 97% of the rays, but I tell people as high as you can tolerate. If you find a good sunscreen that's 70 or 100 that you can put on that feels good on your skin, use that. Make sure you apply it 15 minutes before. Many sunscreens, especially the chemical ones, have to be put on 15 minutes prior. You can't just slap them on and go outside. That's how people tend to get burned. Reapply every 2 hours, even if it says sport, sweat-proof, you have to reapply it. They are only available for that long.
Quick question, because you mentioned skin cancer in the nail bed, which is what my father-in-law had. How can you protect those areas you can't put sunscreen on?
Well, you would have to do gloves. Some people, they have UV gloves. Many websites carry UV gloves. And also, actually, go ahead and put that sunscreen you can really rub it into that nail bed, down onto your
They should
nails.
make a nail polish with sunscreen in it.
Right?
There we go.
You might be on to something.
Dr. Lamb, thank you so much.
Thanks as always.
Of course, thanks for having me.
Great tip.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.